The local alcohol environment is important for public health. International evidence shows that making changes to where, when, and how alcohol is sold can limit drinking and some of the harms it can create. Public health teams in local authorities often struggle to decide how best to engage and what is worth the effort. Licensing laws in England and Wales do not currently include a public health goal. Evidence shows that this makes it hard to know if and how to get involved. These are some top tips from public health evidence and practitioners in the field. We'll start by looking at a few strategic tips. Firstly, engage early in the Statement of Licensing Policy, known as the SLP. The SLP can be an important strategic lever, and practical steps might include tracking when the policy is due for review. This is especially important if you work at a two-tier authority, as timings will differ. Next up, preparing structured public health input. Another practical tip is that around framing evidence around inequalities, local harm, and protecting children and young people. And finally, offering briefing or training support where appropriate. Early policy influence may shape decision making over a longer time horizon. The second of our strategic tips is to use specific, localized licensing relevant evidence. Where representations are made, evidence needs to be relevant and persuasive. It must be highly localized. You can use, for example, street or neighborhood level data or constituent testimony, clearly linked to one of the licensing objectives. The legal framework is paramount in licensing decisions. Representations are likely to be rejected if data and evidence do not directly address one of the 4 objectives of the Licensing Act from 2003. Finally, invest in key relationships. Working well with others in the licensing system will help normalise public health involvement. This includes licensing officers, police colleagues, elected members, and other responsible authorities. This is likely important if you want to influence the SLP. Next, here are our day-to-day tips. The first of these is to triage your applications. So rather than attempting to respond to all applications, it might be helpful to agree a small set of local red flag indicators to guide engagement. For example, such as very late or 24-hour operating hours, rapid or online delivery models, proximity to schools or alcohol treatment centres, or locations with known high alcohol-related harm patterns. Having an agreed threshold can help protect capacity and improve consistency. The second of our day-to-day tips is to develop and share reusable tools and templates. Creating structured templates or response frameworks may reduce duplication of effort, it may increase confidence in the public health team, and it may improve clarity and consistency. Over time, this can make engagement more sustainable. Finally, here are our system tips. Advocate for structural change. Have an eye for longer term ambitions with your interactions with the alcohol licensing system. Consider advocating for public health as a licensing objective, as in Scotland, national public health guidance on licensing, dedicated public health licensing resource. This animation was created by NoPH, and you can find out more about this work via these links.